Okay, thank you. We are on episode 3 of the public safety mill levy interviews that I'm doing for social media. And my guest today is Kody Christensen-Linton, which I'm excited to interview in his new position. We'll talk a little bit about that. So I am Penny Ronning. I serve on Billings City Council here in the largest city in Montana. And we're talking about the 2020 public safety mill levy that the voters will have the opportunity to vote on from a mail-in ballot, and ballots are mailed August 28th and due back into the Yellowstone County Elections Office by September 15th. So I've been interviewing different people from the city and different people that live here in Billings. Kody, you are here today as Citizen Kody Christensen-Linton to talk about your new job. So you're at your home. We're not using any city facilities or any city services or any city equipment or anything like that. So we have to make sure people know that. So Kody, can you tell me a little bit about your background? Are you from Billings? How long have you lived here? What's your education? What do you do here?
I live here.
Oh, good, good. We got that settled.
All we need. So yeah, I'm born and raised in Billings, lived here my whole life, 30 years. Went to school at Skyview and then at MSU. Started work right out of high school and kind of evolved from there. But moved, I guess, from the Heights to I'm West End, so all over town.
Yeah, you are all over town. So you and I know each other from when you and your husband did really awesome work for an organization I started called Operation Billings Child, and you gathered from a business that you had all of your clients bring in toys for homeless children for Operation Christmas Child a few years, I guess it was, a while ago now.
Yeah.
That you first started that. And then we knew each other. I was your peer coordinator because you are a CASA advocate. And for people that may not understand the role of a CASA, it is the court-appointed special advocate for abused and neglected children here in Yellowstone County. And so Kody, how long have you been with CASA, and you're a peer coordinator now?
Mm-hmm. So officially with CASA, I believe 3 years now. Mm-hmm. So for the first year, I was just a CASA, and I guess not just a CASA, I shouldn't say.
Exactly, it's a big job.
It's a big job. And then you were my peer coordinator, and then I finished my case after 2 years, and then I am now a peer coordinator, and I have a few CASAs under me.
Mm-hmm. That's awesome. And so basically what a peer coordinator does, so we can share people with that and plug CASA a little bit more, because you and I are both big fans of this organization and know the amazing work that they do for children and families who face real hardships in our community. And so so the role of a peer coordinator, you really help the CASA advocates that are working with children who are in the foster care system, and you help them with their case. You are a mentor with that case, and you really help that advocate and support that advocate along the way. And it's a big job. It's a really big job to do. I know at one point in my role as a peer coordinator, I had 10 CASAs and 17 kids. And it's a big job. It's a volunteer job that we do, and you are a rock star as a CASA, Kody.
It's a lot of reports.
A lot of reports that go to the court, into the court system. You're absolutely right, and go to the judges. But Kody, you are an absolute rock star in the CASA world, and so proud of you with that. But you also serve, if I'm remembering correctly, you also serve on the board of Family Promise. Is that correct?
Yes, I am the vice president of Family Promise.
Oh, wonderful. So tell us a little bit about Family Promise also.
Family Promise is another shelter in town. They shelter families, and they shelter any kind of dynamic of family. So it could be grandmother, daughter, child. It could be two men and a child, two women and a child, any kind, single fathers. That was mainly why I originally went to Family Promise, because at the time when I joined the board, they were the only place in town that would serve a single father, which was important to me. So they also have developed this entire program to help break the cycle of poverty, which is really exciting and something that I'll get into a little further. But it I mean, they teach them everything from life skills, social skills, job skills, help them with any court appearances they may have, anything on their record. They help them with budgeting. They help them with childcare while they're getting back on their feet. They help them get into housing. And then their success rate is currently, I believe, at 95, maybe 96%. And they don't measure it at success until it is a year after they've exited the program. So a year after, they're still not homeless. So that's when it becomes a success story, not immediately after exiting the program. So it's really cool.
Oh, that's fantastic. And gosh, I learned a little bit about Family Promise today also. So thank you, Kody. And that, you know, your background really gives insight into why you wanted to interview and go for the job as the rock position here in Billings. So for those that don't know what the rock position is, and that's ROC, can you tell us what ROC stands for? Can you tell us what the rock position is, what geographical areas it covers, the duty of your position, and how your position is funded, and just some of those areas?
Yeah, absolutely. So the Resource Outreach Coordinator position, so it stands for ROC, or I guess ROC stands for Resource Outreach Coordinator, but it's through the Downtown Billings Alliance, and it's funded through the county matching grant. So I work in part with the Crisis Center and the DBA. So working with the DBA, I work with the downtown resource officers. And with that, we travel around the bid district and the safe district mainly, which the bid district goes anywhere from, I believe it's 22nd to 30th, all the way up to Stockman Bank off of 6th or 4th, and then to Minnesota. And then it's not a perfect square, but kind of originally when the bid was created, these were the buildings that wanted in that district. So the safe
and BID stands for the Downtown Business Improvement District. Yeah.
And then the safe zone goes all the way up to the hospitals, dealer park. So we go over that whole area, and we'll either be on bikes or in the patrol car, North Park, South Park, that whole area too. So in that, we ride around, and our goal is to help get at-risk individuals into treatment rather than giving them more tickets or sending people in filling up the jails. Our goal is to break that cycle as well. So I'm really excited to get this program going, and we're going to try a couple new routes. We work with Community Innovations, Continuum of Care, Substance Abuse Connect. It was the MAP program originally, and we're still building off of that a little bit too. Don't ask me for what that stands for. I've learned way too many acronyms in the last few weeks.
Yeah, I get that.
It's a motivated addiction alternative program, I believe.
Yes, correct. You're right. Yep.
I should get a bonus point for that, remembering that one.
Yeah.
But yeah, so we've been building on that, and it's really exciting to get all this going again. Over the last, I believe it's over a year now, that there has not been a rock downtown. And I think that everybody that I've come in contact with, including the business owners, because I work a lot with the downtown business owners and building owners, all of them have said that it's been a significant difference in the last year not having a rock downtown, because he's downtown meeting with these people, getting to know them, trying to get them into treatment. So I also work with, because I'm not an LAC, previously in the past, the rock was an LAC, a licensed addiction counselor, and I'm not one. So I work with Dominic Oldell from the Mental Health Center, and we have him contracted for 10 hours a week through the county matching grant as well.
Oh, okay, wonderful. And so, so you said you referred to the downtown resource officers. So can you explain those positions a little bit?
Yeah, Officer Manser and Officer Nichols. Gosh, I almost forgot his last name. I only know their first names. So they are originally, I mean, they've gone through, they're Billings police officers, but basically they're contracted to work through the DBA as focusing on the downtown area solely. They don't just go around with me. They don't sit in an office. They go out and do outreach all day, and they'll still go on regular calls downtown as well. And sometimes they get called out of downtown just because of the number of cops that are in town when situations happen where they need more cops around town.
Yeah, so they are official Billings police officers, but the role in which they serve in the downtown is helps to be funded through the DBA.
Right.
And I think the downtown business improvement district, correct?
Correct.
Yeah. so that's great to know. And I've gone on a ride along with Officer Manser, and boy, he's awesome. I mean, that guy is really amazing. And I was really excited for him to get this position as a downtown resource officer, because this is just right in his area of passion and compassion and area of interest in being a police officer, and in such a big part of why he really went into law enforcement. So really excited about that, and really excited that the two of you are working. Okay, so I've got a dog right here who is, told you I had 4 dogs. So I've got a dog right here who keeps bumping my arms. Anyway, so Kody, how did you become interested in the ROC position?
So I'm also I guess I should have said I'm also a business owner too. So I originally had our business downtown. It was a private personal training studio and yoga and group fitness. I also have worked with the adult treatment courts in town, so the Steer and the Camel Court, which are another great program.
Mm-hmm.
Working with the court, I created a program which is FIGHT, and it stands for Finding Independence with Guidance and Health Treatment. So it is part of their treatment plan to come get workouts and nutrition, so kind of leading them on a healthier lifestyle. Mm-hmm. I owned the business downtown, and gosh, for 6 years we were downtown. So downtown also has a big passion in my heart. With that though, I've, over the last few years, being a business owner, because you're not busy enough being a business owner, right? So
right.
I get a little stir crazy, so I join as many boards, commissions, side projects as I can, for things that align with what's has a special place in my heart. So a lot of times it's youth and at-risk community. With that, I have been involved with a few boards and commissions, different services around town, volunteering, different resources around town. So like Tumbleweed, St. Vincent de Paul, kind of everywhere and around town. But I have already been in this community for so long, and when I saw this job come up, I didn't even know it existed downtown. Mm-hmm. So when I read it, I was talking to Zach, my husband, about it, and he was saying, you know, it's funny, like you already do most of these things, so maybe you get paid for it.
Exactly. Yeah. Why don't you try to get paid for them? Yeah.
So it's something where I'm really excited to get it going, because it's something that I can, I guess, justify spending more time on something like that, where it's actually my job now, or I can spend all night working on something instead of something where it's volunteer work and I'm trying not to dig myself in a mental hole.
Yeah, absolutely. So what type of professional training have you gone through? Because I know you've gone through training in your ROC position, you know, already. You've had some training, you've been going to training classes. What type of training have you been going to?
So I go through crisis intervention training. Mm-hmm. So that's something that's obviously going to come into play a lot. Also, we've been getting as many resources together as we can where I can join, kind of learn as much as I can, kind of just a sponge at this point. So I've been doing a lot of the cultural training. So I went to this seminar the last week for Native American cultural training, which was really interesting, really cool. It was a 3-day event, actually, based out of Colorado. So that was cool. This coming week, I have a seminar all day Friday, which is really exciting too, also based on Native American culture. Mm-hmm. We've gone through a few different webinars, seminars a little bit, mainly focusing just around like the crisis intervention.
Sure.
So kind of around that currently. I mean, I've only been in a few weeks, so.
Right, exactly. You are new to the position, and you know, make sure that people understand that. And I know that the Crisis Center is moving in the direction, and this was one of the things that Chief St. John really supports. And he too wants to move the Billings Police Department out of the social services business and back into law enforcement business and proactive law enforcement business, meaning preventative, to do more crime prevention, and making sure that our Billings Police Department is more accessible and able to do crime prevention than than what we are right now, where we're just more of a response type police department. And so I know that he's really wanting to push and move in that direction. So he's been very supportive of the crisis center's project that they've been working on and getting a grant for the mobile crisis unit.
Mhm.
I know that that's something that Chief St. John would like to have also and be a part of and support with the Billings Police Department. So,
Yeah,
so
the
yeah,
resource working on mobile crisis units and
yeah,
things too, which is really exciting to see.
yeah, yeah, absolutely. And what that does is that allows mental health professionals to go to the calls that right now are being responded to by Billings police officers. And so these would be mental health calls, substance abuse, addiction calls, things like that, where we're just a better trained and professional in the industry that really is there to work with a population that is struggling with mental health, and they may be struggling on the street with mental health. So
To
that's exciting.
now, and the consensus is that they're tired of being social workers. So.
Yes, yeah, that's absolutely true. And we hear that over and over and over again from the police department. So what is your typical day like as a ROC?
So the last couple weeks has been a lot of meetings, but mainly what it's going to be is that I am going to do a lot of the outreach in the morning to the at-risk community, going around talking to them, seeing who we can get into treatment that day, because obviously it has to be that day that we have this, which is also really important. That's why we wanted an LAC contracted that we have for 10 hours a week.
Mm-hmm.
So when we come up across someone, we can get them in there that day, because if you say, oh, what about tomorrow? What about next week? Probably not going to happen.
Mm-hmm.
So we do our outreach earlier in the day. Hopefully we can get them in there that afternoon. We are kind of riding around, talking to other business owners, building owners. If anybody, we get a lot of calls a day too, through the downtown cop line, where if anybody needs that info, I'll send it to you and you send it out. But there are business cards down at the DBA office for them as well.
Okay.
We get a lot of calls for either somebody is asleep on their step out front or on public property, which is a really hard situation, because if they're on public property and they're not breaking the law, we can't do anything about it.
Mm-hmm.
So if they're blocking the walkway, then we can move them along. But bottom line is, if it's public property, there's not a lot that can be done, just because of the laws that are currently in place.
Right.
So with that, we get a lot of calls to either come move a group away from a private business or off of private property. We get a lot of trespassing, a lot of open container throughout the day, public urination, anything like that. So.
Mm-hmm. Well, how does the ROC position engage with the Billings Police Department, the Billings Fire Department, downtown business owners? Because you work very closely with all three.
Mm-hmm. So with the business owners, all of them have our phone numbers. The majority of them have our phone numbers. They can call us at any time. If anything's going on, we want to know about it. We'll be there within minutes. You know how big/small downtown is, so
Right.
You can get that pretty quick, especially on foot or on a bike. But the working with the resource officers, we come to calls. We'll go up to whoever the individual is that we're there to deal with, and talk to them, figuring out what's going on. My goal is to educate more people on it and realize that each person is different. So not one resource is going to work best for everyone. So that's why when we see a lot of people sending everybody to the same location, that's not what's always best. And sometimes that's why people refuse going to treatment, because they've been either turned away from a treatment facility or they weren't accepted right there, something that made them feel uncomfortable. So I try to engage with them, get to know them a little bit as quick as I can, whether that be I just develop relationships with all of these people over time, over weeks, but understand what facility would work best for that person. So with that, I work with the resource officers too, and they come to all these resources with me for these meetings, and we're trying to get everybody on the same page and work together as a collective team rather than reinventing the wheel in 10 different rows. So
exactly, or everyone just working in their silos.
right, and everybody specializes in something, and realizing that if you focus more on the thing you specialize in, then we can get a lot farther working as a team. If you say this person specializes with this person with this, but they're all still trying to do this at the same time, they can focus on what they specialize in rather than having everybody try to accomplish everything. So
absolutely, and also working that way, it's easier to see where the gaps are in
right.
the community and how we can fill those gaps. You know, because some of the organizations may say, gosh, yeah, we do this one thing well, but maybe someone else does this one thing much better, and we could actually do a really good job at filling that gap.
Yeah, exactly.
And it really helps, you know, that it really helps. And it also helps spread the resources out and gets the organizations really working in as team members here in the community moving forward. You know, you spoke about a few of those teams that are out there working earlier on. One of them was Continuum of Care. And so just to share with people, Continuum of Care is a committee that is required for municipalities to have if those municipalities accept federal housing, urban, and development money. So and Billings accepts HUD money. So as a result, we are required to have what's called a continuum of care. And that means that you've got a structured organization within your municipality that is looking to see how those HUD dollars are being spent. They're working on homeless issues within the community and really working to address homeless and poverty related issues. And we've got just such an amazing continuum of care group that has come together in the last couple of years. Kristen Lundgren, Erica Willis, Patty Webster, these women have done just such an amazing job of organizing our continuum of care. And then you talked about Substance Abuse Connect Coalition. Again, same amazing women leading this. Kristen Lundgren, Becky Bai, and then all of the organizations that are involved with Continuum of Care, which includes the City of Billings, the Billings Police Department, the United States Attorney's Office, Rimrock Foundation, you name the nonprofit organization that works with mental health or substance abuse, they are involved. Same with law enforcement. They are involved with Substance Abuse Connect Coalition and doing absolutely amazing work, phenomenal work. And yeah, go ahead.
Engaged with them a lot is the Healthcare for the Homeless for Riverstone, which has been great. Been seeing them at a lot of things, and they're really excited to get people working together and really solve this issue. So
yeah, absolutely. And people don't often realize how far along in Billings we are in regard to some of these social issues and addressing the social issues, especially with a conversation about defunding the police. And defunding the police doesn't always mean you're taking money away from the police department. It means that you are contributing funds to social issues that work to prevent future crimes and prevent generational crimes and improve the health of the community to really do just what I said, prevent crime. And Billings is really far along, and we just don't toot our horn enough about what we are doing. And I think people also think that problems are solved overnight. Mm-hmm. And these problems are not going to be solved overnight because they have real systemic issues and roots in poverty, in racism, and in a number of other issues that are going to take real community truth and honesty in addressing these issues. Mm-hmm. And being able to really compassionately change the way we operate our economies. And that's what's going to really address these systemic issues. But so in regard to your position also, Uh, what have you, and I realize you've only been in your job for 3 weeks, I get that, but you have a history in Billings of really addressing some of these social issues around mental health, around homelessness, around poverty, around substance abuse. What are you experiencing so far in the few weeks that you've been at your job? What do you, from your experience, where do you see Billings is lacking in service? Where are we doing well? What can we improve upon?
So is Billings perfect? Absolutely not. We have a lot of great resources, and that's why we get the majority of these issues out of the state, is because we have the most resources. However, we don't have something for everything, unfortunately. So one of our biggest issues is the mental health crisis, and that's something that is not going to go away, but we need to be better prepared for it. We need more space to handle it. Like you said, the crisis center is working on a mobile crisis unit, and I know other areas are working on that as well, or something similar, and that's something that's going to make a huge impact. These issues are never going to go away. It's not going to be, especially like you said, overnight, it's not going to be something where people go downtown and don't see somebody suffering from a breakdown. Right. That's just not going to happen. But we need to be better prepared on how to handle it. And that's where I'm seeing it. It's not that we don't have resources available. It's not that we don't know what to do. It's that we need to figure out the best way to make it happen and get handled quicker, which is why I'm excited for the mobile crisis unit. The other issue is that I'm seeing, and I know it's been discussed in the past, and I've been researching a lot of other cities, similar demographic as Billings, on how they handle it, and a sobering center would be great for Billings, and that would save up a lot of police time, it would save up a lot of EMTs, it would save up hospital beds, because and that's something I deal with a lot in the last few weeks especially, you have somebody that's just severely intoxicated, passed out on the concrete, you have to call an ambulance, or an ambulance and a fire truck, take up both of their time to haul them to the hospital to sober up. And then at that point, then you can assess if they have mental health issues or something else that needs to be treated. But at that point, they could have been at a sobering center just being recovering there. And then at that point, somebody can come in and meet with them, whether it be an LAC or me or the police officers or somebody, to say, do you want to go into treatment? Do you want to be seen for this mental health assessment? Do you want to be seen for these other health issues that we've seen on you while you've been here for the 20 hours or whatever it may be? But it's something that definitely needs to be discussed again. And I think that now Billings is seeing the problem a little more than last time it was discussed. So with that, it's also not something that's going to happen overnight, because there's legislation that needs to be involved too, because Billings in Montana does not have public intoxication laws, which at that point, one of the things that made our program work so well in the past was that there was room in the jail, which Billings just doesn't have a big enough jail for the size of the city. The amount of people that were getting ticketed or being arrested for minor offenses, the reason why our program works so well is because they had the option, just like the adult treatment courts do. Do you want to go to jail? Do you want to be ticketed? Do you want to pay this fine? Or do you want to go into treatment? So you're not forcing people into treatment, but you're encouraging them in a way that they see the benefit. They're not going to be punished for these offenses. They're going to be going into treatment. Will they always stick with the treatment? No, that's just how it works. That's why it's a disease. It's mental illness. It's substance abuse. It's a disease. That's just the way it is. So if they don't stick with it for the rest of their life, if they don't stick with it for 6 months, that's fine. We have the available for them when they need it, and that's the way it works the best. And because you see these people, they're recovered is a fallacy. It's not true. You're always recovering, and that's something that people need to understand as well. So
right, yeah, absolutely. And you're spot on. It's not a crime to be mentally ill. It's not a crime to have a disease. And unfortunately, when we don't have our state legislators who understand that and help municipalities fund social services, or our federal government help municipalities fund social services. You know, and I shared this in the last interview, and I say this often when I talk, decisions that are made at the state level and at the federal level, those decisions don't play out in some make-believe cloud. They play out on the streets in our cities. They play out in our local communities. And so when those funds are cut, it puts the pressure and the burden on those local governments, those local nonprofit organizations, to deal with the state trying to balance their budget.
Right.
And then we're left dealing with this. And for the most part, Billings deals with it on such an extreme level compared to the rest of the state, because, I mean, we know that different rural communities, they do not have the same type of resources. So people will be put on a bus and they will be sent to Billings to try to receive resources. And good luck with that, because the waiting lists are really long. And so we're not only dealing with the people within our own community that have mental health crisis or battling substance abuse, we're dealing with people from some of these small farm communities, or not necessarily even a small farm community, but a smaller community than Billings or Bozeman or Missoula, and the more urban centers. Those people will be sent here to try to receive some type of resources. And it just burdens the municipalities, because this is where everything plays out. Every decision in government, whether it's local, state, or federal, plays out on our city streets, plays out in our towns, plays out in our local communities. And, you know, we're definitely seeing that in regard to mental health crisis throughout our country, you know, and drugs throughout our country. You know, meth is definitely one of the drugs that we deal with right here in Billings. And we see the impacts of meth addiction right here in our local communities. And it is challenging and it is hard. And, you know, thank God we have business owners that are willing to help fund positions like the position you're in right now, the ROC position, because that is your position is funded by a private public partnership. Same with the downtown resource officers. Same with some of our other resource officers with the Billings Clinic, with the school district. Those are private public partnerships. And hopefully we can continue to move in that direction to allow you to do the job you want to do, allow the police officers to do the job they want to do and that they are trained to do, which is enforce the law and prevent crime. And hopefully we can get the crisis center and Tumbleweed and the mental health center and Riverstone Health and all of the amazing organizations doing the work they want to do.
Right.
But it's reimagining the cities that we want to live in and how we fund those programs and how we use tax dollars to fund those programs. But yours is one of those positions that's really awesome. And I'm so glad that you are in that position, Kody. So what do you want the public to know about the people you serve? Because I know you have a great heart for them, and there is a real misconception about homeless people and people on the street.
I mean, the main thing that I tell everyone is that they're people, bottom line. And that's something that I think a lot of people look over. They look at it as an issue or that it's a problem downtown. And that's not true. They're people, they have families, they have just as many issues as the next person. Are they just as well at handling them? I don't know, maybe not. Have you sat down to talk to them? That's my thing. And it kills me how many people avoid them without, they just look at it like a problem, and it bothers me.
Yeah.
They're people and they have problems. They have mental health issues. They have addictions just like everybody else. And they need help. So that's something that I don't understand. I can't really wrap my head around that people won't help. So, and I mean, we got to work together as a team to solve it, or otherwise it's never going to happen. And I was not raised to put somebody else's life on the back burner, just so I could live my own life. That's not how I was raised. So I don't do well when I come across somebody like that. But I think that if everybody could sit down and have a 10-minute conversation with somebody, understand that they have a story too. Where did they come from? Tell me about yourself. They're not going to bite you. And I think that it's really important to understand that you have the ability to change their life too. And that's something that is powerful. And I think a lot of people don't understand. They don't know where to go. They don't know how to help. There's so many nonprofits in town that you can join to volunteer at. Just start volunteering. That's what I did. I volunteered, I think at Tumbleweed was the first place I volunteered at. I cooked Thanksgiving dinner there for one year.
Mm-hmm.
Now it seems like I can't say no.
Yeah, I get that. And the need is great. And all of those organizations, they do need volunteers. And, with COVID, they especially need donations. And, their donations I'm sure are down, and they most definitely need donations. They are such an important impact. They have such an important impact on our community. And I really like what you said, Kody, about acknowledging humanity and acknowledging the humanity that we have in our downtown area. At least that a homeless person is not a problem. They're a human being. And there is a real struggle and real challenge. And, it's really hard and it's really expensive to be poor. Mm-hmm. And there are massive mountains that these individuals are climbing every single day that you and I will probably never have to climb that mountain our entire life. And Kody, I just so appreciate your heart, and I appreciate the value that you bring to our community and our downtown area and the job that you're doing. And a friend of mine once said to me, "I love your way." And I was like, "What do you mean my way? Like, is there supposed to be more to that sentence?" And then I realized, no, that was such a powerful sentence. So I say that often as well. Kody, I love your way. You love big, and you have an amazing approach to people and humanity. And really glad that you are able to work with the officers that you work with and the fire department, because you work with them as well. And so if people see you in a purple shirt downtown, tell Kody hello. And black. Are you do you have a black shirt now?
Black shirt.
Okay? Oh, you do have your black shirt on. Yeah, that is. There you go. Okay, there you go. Because the last time I saw you, you had your purple shirt on, so you got your black shirt now. Oh, that's awesome. Yeah, that's awesome. Well, I'm glad to see that. Well, Kody, you do an awesome job for this community. And is there anything else that I didn't ask you about that you wanted to touch on?
No, I think that we handled a lot. Obviously, this conversation could go on for
years. Yeah,
but
absolutely.
I'm glad to have some city council members that are really invested with this and want to see the change in a positive light.
Yeah, absolutely. Thank you, Kody.
Yep.
Oh, you were muted. So what were you saying?
I said, and not just sweep it under the rug. So.
Yeah, no kidding. I agree with you. And really address it, from an economic standpoint as well, because when the health of our community is stressed, the economy falters and crime rises. And we know that.
And economic wise, I mean, that's a whole other conversation, because I think a lot of people hear that we need these resources and then they automatically go to, that's going to cost money. That's going to cost me money. That's going to raise my tax dollars. The only way I know how to explain this is you're paying for it already. You're paying for it regardless. So it can either be in a way that will hopefully prevent them from happening again, from breaking that cycle of poverty. But you're already paying for it through sending cops after them, for sending EMTs, for sending a fire truck, for sending them to the hospital. Where do they think this money comes from?
Right.
It's already out there. So we need to do something that's going to benefit them in the long run.
Right.
It might have some startup cost, but we haven't even had that conversation yet because nobody wants to, because they think that it's going to cost money.
Yeah.
It's something that is important, that needs to be discussed and not tabled for later discussions. It needs to happen the sooner the better, because the sooner we fix it, the sooner that the dollars shift into more positive way.
Yeah, you're absolutely right. Continuing to kick it down the road just continues to make the ask more expensive every year. It really does, and it increases the cost to the overall cost to the community. And I couldn't agree with you more. The faster we address this economically, the faster we put money towards this, the sooner we're going to start to see the downshift of crime and the downshift of substance abuse addiction, and the increase of really helping people that have mental health issues, and seeing that less and less on the street, and getting people really functioning as the human beings they most likely want to be functioning at the level that they want to be functioning. And that just improves the overall health of the community, and that's where we're going to be able to really increase the type of public services we provide that benefit the whole. And so I couldn't agree with you more. Okay, well, Kody, thank you so much for being part of this series and this interview, and I so appreciate you and value you, and rock on, rock. All right, thanks, Kody.